Hi, and today we are here with Adrian Shanker, he, him pronouns. Adrian is editor of Bodies and Barriers, Queer Activists on Health, and the executive director of Bradbury Sullivan LGBT Community Center in Allentown, Pennsylvania. A specialist in LGBT health policy, he developed leading edge health promotion campaigns to advance health equality through behavioral, clinical, and policy changes. Adrian administered data collection for the 2015, 2018, and 2020 Pennsylvania LGBT Health Needs Assessment. Adrian serves as commissioner and health committee co-chair on the Pennsylvania Commission on LGBTQ Affairs. Hello, Adrian. I'm Sable. I use she, her pronouns. I'm the manager of the Transgender Services, and it's good to have you here today.
So great to be here with you, Sable.
So tell us a little bit about the book that you edited. It's Our Bodies, or edited Bodies and Barriers, Queer Activists on Health. So tell us a little bit about that.
Yeah, so Bodies and Barriers, Queer Activists on Health is an anthology of writing by 26 queer activists from around the world who tell our own stories about our bodies and the healthcare experiences that we've had, the challenging healthcare experiences we've had in attempts to access quality care. And unfortunately, LGBTQ people across the country and throughout our world still don't achieve health equity. We still experience barriers to care at every step of the way. These barriers are pervasive throughout our lives, and they prevent us from accessing the care that we need and the care that we deserve. So this book is a collection of essays by a diverse group of authors representing different geographies, different gender identities, different races, different sexual orientations within our community to try to tell our own stories. So much of the literature that's published is written by researchers or healthcare providers about LGBTQ people. And this is why Bodies and Barriers is different. This is our own community telling our own stories so that hopefully our healthcare professionals will hear it, hopefully our policymakers will hear it, and activists, fellow activists for LGBT health and for healthcare reform more broadly.
That's amazing. In your introduction, you talk a little bit about some of the inspiration for editing this book. Would you care to talk a little bit about that to our audience today?
Yeah, I mean, I've been privileged with health insurance and with ability to access care, and so I was surprised when I went to a dermatologist for a baseline screening for skin cancer, and at every step of the way, I felt like the care that that doctor was providing wasn't care for patients like me. From the restrictive intake forms to the biased news programming on television in the waiting room, the magazines in the waiting room that just were not for my clientele. And then the actual clinical visit, which was so traumatic, I decided not to return for the doctor recommended follow-up. That experience was not unique because I started talking to many of my fellow activists, many other friends, and asked them to tell me what their experiences were. And person after person, friend after friend, I heard similar types of experiences, and not just in one type of care, but really pervasively. It was necessary to compile these stories and many others into a book, an anthology of our writing, because our narratives as healthcare consumers, people who receive healthcare, who pay for healthcare, is not one that is desired. Our experience is not the desired outcome, frankly. We experience health disparities for so many reasons, and one of those reasons is that LGBTQ people are not accessing care equitably. We need to tell our stories, and that's what this book is about.
That's amazing. In putting this anthology together, what are some of the stories that you came across, or what is one of the stories that you came across that sort of surprised you or you didn't expect until you came across it in submitted writing?
So I guess I have to say that unfortunately, not much of it surprises me anymore, but a lot of it seems to surprise healthcare professionals. So I think that, as queer activists, sometimes we have to remember that the healthcare professionals that are providing the care aren't as familiar with the challenges our community experiences as we are. That's one of the reasons we have to tell our stories. So for example, one of the first chapters in the book is by Elisa Bowman. Elisa is the parent of a transgender kid, and she writes about navigating pediatric care for her son. And she writes about how when her son came out to her and her family, she had phone calls with many people, her family, her her kids, friends, families, all the people in her life, except for her pediatrician for her son. And she decided to ghost him instead because she didn't feel that he would be able to provide affirming care for a gender creative child. And so she ended up looking for a different pediatrician that specialized in trans affirming pediatric care. And that extra clinician was over an hour away from where she lived. Right, so the geographic barrier to care there. Another story is from Robin Oakes. Robin is one of our country's, most effective in many ways bisexual community activists. And Robin writes about a story from her 20s when she went to a primary care doctor, and the doctor said, are you sexually active? And she said yes. And the doctor said, are you on birth control? And she says in the book that she wanted to reply flippantly that she uses the lesbian method, but she wasn't that brave. And instead, she, in her words, hemmed and hawed and squirmed uncomfortably, and it was awkward and uncomfortable. And then when she went back, when that relationship ended and she was in a different relationship with a person of a different gender, she had to then come out again to the same doctor, right? So the experiences of bisexual community members is very different than the experiences that I have as someone who is queer/gay, and the experiences of trans people is very different. So this book collects a lot of these stories. One more example I'll share is a story from Laura Jacobs. Laura is the board chair for Callan Lord LGBT Health Center in New York City. And Laura is also a clinician, but she writes from the perspective of, Laura, a person who happens to be trans, who happened to be seeking care from an ear, nose, and throat doctor. Now, a lot of us might not think about ear, nose, and throat as a specialty that's uniquely, where we need a queer-friendly doctor. But the reality is, if we have, if we're queer people and we have ears, we need a queer-friendly ear, nose, and throat doctor. If we have skin, we need a queer-friendly dermatologist. And in her story, the doctor walked in with an intern and immediately said to the intern, in quotes, Laura's a trans, didn't the surgeons do an amazing job? And Laura's sitting there horrified, but also recognizing in her own words that this is a doctor that's about to wield a knife inside of her throat. She was there for, issue with tonsils, and the doctor had never seen her below her neck without clothes on. So it was inappropriate and a wrong comment to make on so many different levels, which she details exactly what the problems were in her chapter. But also, it's a reason why so many people may not seek care when they're sick or when they need healthcare in the future, because the fear of those negative experiences is just so great. And that's why it's important that we tell our stories and we get these stories out there. So this book is organized to take us on a journey through the lifespan. So it starts with youth, then young adults, middle-aged adults, and older adults. The final chapter in the book, Sable, is by Justin Sabia-Tanis, who writes about bereavement support for same-sex couples. And Justin is a queer trans man who is grieving the loss of his partner, and asked if there was an LGBT bereavement support group, and there wasn't. And he was assured that there was, no discrimination, that the bereavement support group would be provided equitably. All people would be treated equally here, they said. And he said, they did. Like, they treated him equitably, but that was the problem, that it would have broken, in his words, the unspoken social contract of the group if he made his concerns about his identity, because nobody wanted to talk about specific identities, and that sometimes we need services that are unique to who we are.
I remember reading that story in particular and recognizing, especially right now with a global pandemic going on and the challenges that we have around family members, parting of family members, and also reflecting on growing up in the 1980s and the HIV epidemics, and picturing that same impact that we have around grief. I thought it was an amazing piece. What, based on some of the things that you read in some of these essays, what would you recommend to LGBTQ readers who are navigating concerns around healthcare and health equity in their spaces?
Well, I think that right now all of us are at least subconsciously thinking about our health during these COVID-19 times. I mean, this is a dangerous virus, and but for LGBTQ people, this is not our first virus. Culturally, we know something about surviving a plague, and we know the importance of taking public health messages seriously. So I think all of us at some level are thinking about our health, even if it's, who are we going to go to if we need a COVID test, right? If we get sick, will we be treated fairly and equitably in our local hospital? These are things that are at least on the back of our minds, if not front and center. And things that LGBTQ people might consider in this moment, especially, but really at all moments, is first, it is important to develop a trusting relationship with a healthcare provider, someone to provide routine primary care, someone that will know our medical history, someone who will know our vaccination history, someone who we can get an appointment with quickly when we're sick, and that's very important. But many LGBT people do not have a primary care doctor, and so it is important to try to find an LGBT affirming primary care doctor, in our own communities. This is actually a great time to find one for folks who don't have one, because telehealth is more available than ever. And so if it's a need to find someone that might be a little farther away, it is a good time to do that. Another thing, though, is more of an activist action. So this is a great time to take action for a healthcare system that works for all of us. This is a great time to make sure that LGBTQ people's voices are heard, and that and that we fight for a healthcare system that does not leave our queer and trans bodies behind, but that ensures that healthcare will be provided equitably for all of us. This is a moment in time when the fight for health equity is on. And I don't only mean because of electoral politics. I mean, in the world we're living in today, this is a present issue. It's one that it's important to speak to legislators, to speak to doctors, to write letters to the editor and op-eds in newspapers about the importance of fighting for health equity. Health equity means the attainment of the highest level of health for all people. That's the U.S. government's definition. It doesn't say for all men or for all white people or for all straight people or all cis people. It doesn't even say for all citizens. All people deserve health equity, and we don't have it right now, so we have to keep fighting for it.
Yeah, for sure. What are, in terms of the work that you've done over the past couple of years, what are some positive gains that you've seen within our health industry over the past decade, 2 decades?
Well, I would say first off that the Affordable Care Act, while not perfect, did create a significant change in terms of LGBT health. In fact, possibly one of the most significant changes in recent history, in that it provided coverage without pre-existing condition discrimination. So a person living with HIV can more easily access care. Trans people can more easily access care. People living with cancer or cancer survivors can more easily access care. And that's really important because the LGBT community as a population experiences things like HIV and cancer in higher rates than the majority population. So access to care is very important, although it's not the end of this discussion, it's the beginning of one. We also should remember and acknowledge that we follow as activists on a path that was paved for us by brave and dedicated activists, the ACT UP and TAG activists of the early days of HIV, who stood up and demanded that pharmaceutical companies do better, that the government do better, that the President of the United States say the word AIDS, that there's an acknowledgement of the harm and the pain, and then that acknowledgement's translated into actual action. So we stand on the shoulders of giants who paved this path, and we need to also remember that we are not done yet. The fight for health equity has not been achieved. We have much, much further to go. Even if we're only talking about HIV, we have further to go. But when we talk about the entirety of queer people's health, which is really all people's health, um, we have much further to go. I mean, there still are way too many people that experience barriers to care, that experience outright discrimination from care providers. You know, the Trump administration has proposed everything from religious, objections to providing care to removing non-discrimination protections from the Affordable Care Act. I mean, we have to keep fighting for our health, because without our health, we don't have our lives.
I really appreciate that within your book, Bodies and Barriers, that you go beyond simply considering what happens in the physician's office. You have a number of essays which talk about the importance of sexual health and relationship health within our communities. Can you talk a little bit about the choice to include some of those pieces in there?
Yeah, I think that sometimes we presume that health is narrow, but the reality is that health is a very broad topic. So it's impossible to talk about our health if we're not talking about the social conditions of our lives. Meaning, we can't talk about health if we don't talk about housing. We can't talk about health if we don't talk about transportation. We can't talk about health if we don't talk about education, right? These social determinants of our health impact the rest of our lives and the healthiness of our lives. So for example, Amani Woody, an amazing activist in Washington, D.C., who has founded Mary's House for older adults, writes about housing as a human right, and housing as a social determinant of health. That for LGBT older adults in particular, the ability to access safe and affordable housing is as important to their health as the information that they got from their doctor last time they saw them, because it's just essential. And so often we silo these into different areas, and we shouldn't. When we talk about sexual health, sometimes there is a presumption, an incorrect presumption, that LGBT health just means sexual health or just means HIV, and that couldn't be further from the truth. But also, it does mean sexual health and it does mean HIV, right? So for example, Emmett Patterson, who grew up in a rural county in Pennsylvania and now lives in Washington, D.C., writes about accessing sexual health education as a trans youth, and the challenges accessing information. And actually, Emmett writes about attending a session in college where the sex educator didn't show up. And Emmett writes that it wasn't the first time that queer and trans youth were let down by adults. And instead, Emmett and his peers started teaching each other. And then they used the opportunity to do peer-to-peer sex education for queer and trans youth, because access to information is vital. And it's important that we have opportunities to provide that information. If someone is interested in achieving health equity, they can fight their school boards to ensure that there's comprehensive LGBT inclusive sex education in schools. It's not only fighting for healthcare reform, it's also health education and health information as well.
There's a quote that you use: wellness is about surviving in a world that was not created for you. I found that an amazing quote to consider, especially in context of health and healthcare. How has that influenced some of the work that you've done?
So there's two quotes that neither of them are from me. They're both from other people, but I quote them in the book. So a 14-year-old youth program participant from Whitman Walker Health, an LGBT health clinic in Washington, D.C., said, "Wellness is about surviving in a world that wasn't made for you." And then Sean Strube, one of the early leaders of ACT UP New York, he was a fundraising chair of ACT UP before he founded Pause Magazine. Sean says, "Stigma is about other people making a moral judgment about your worth, other people making a moral judgment about your worth." And so when we consider both wellness and stigma with those definitions, I think it's really powerful. So first off, wellness is a dream that is often unrealized for many of us. And stigma is the reality of many of our lives. We experience stigma when it comes to body image. We experience stigma when it comes to um, our sexualities or our genders. We experience stigma really throughout our lives. Certainly with mental health concerns, people experience stigma in a way that's different from other diagnoses. So really what this book is trying to accomplish is to drive us further toward wellness, and to encourage that policy change can also help to eradicate some of the stigma.
Wonderful. Are there any last parting thoughts that you would leave for audiences and readers?
I mean, Bodies and Barriers, Queer Activism on Health, this is a book for everyone. This is not an academic book. It's a book written by activists of all types. And it's our own personal stories. These are stories that can then be utilized to fight for change. Ray Carey in the back of the book says, to fight for change in the doctor's office, in the halls of government, or in the streets. So it's really, however we want to be activists for queer health and human rights, this is a book that can be a roadmap for our work. And I invite everybody to continue to tell our stories and to tell your stories, because that's really what will make a change, is when all of us speak up, share our stories, and demand health equity for all of us.
Great. Thank you so much, Adrian.
Uh,
Again,
just to share, if anyone's interested in getting the book, it can be purchased through any online bookseller or a local bookstore, or at pmpress.org/bodies and barriers.
and we'll make sure to have a link to where you can purchase the book down in the description. Again, thank you, Adrian. Adrian Shanker, editor of Bodies and Barriers, Queer Activists on Health. It was wonderful talking with you today.
So nice to speak to you.